Hello everyone, welcome to Dental Subjects. Today's topic is about the dental embryology. That is, we are going to see about the development of teeth and its surrounding structures like lips, nose, cheeks, palate, and tongue. Okay, let's get into the topic. We are starting with stomatodeum. What is stomatodeum? Stomatodeum is nothing but a depression which forms during the fourth week of the intrauterine life. See the diagram. According to this topic, diagrams will be helpful in easier understanding of the concepts. So please kindly follow the diagram carefully. First, see the diagram. The yellowish structure is the developing brain. Then see the pericardial pouch. Okay, in between the developing brain and the pericardium, a small depression forms during the fourth week of intrauterine life, which is known as stomatodeum. It gives rise to the future mouth. Okay. Then, after the formation of stomatodeum, the mesoderm covering the developing brain proliferates, that is, multiplies, and forms the frontonasal process. These frontonasal process grow downwards and overlaps the stomatodeum, that is the depression. It overlaps the depression. It gives rise to future forehead, nose, and the upper lip, that is the philtrum of upper lip. Okay, then after the formation of stomatodeum and frontonasal process, then the pharyngeal arches are laid down on the lateral walls of the stomatodeum. See the diagram. The pharyngeal arch, that is the first pharyngeal arch, which is also known as the mandibular arch. They are deposited on the lateral side of the stomatodeum. When this mandibular arch gives off a bud, that is known as the maxillary process. That is the bluish area is the maxillary process. When the maxillary process grows ventromedially, it forms the mandibular process. These three processes, that is the frontonasal process and maxillary process and the mandibular process, are very important in the face development. Next, during the fifth week of intrauterine life, see the diagram, the greenish area is the frontonasal process, right? When the frontonasal process shows 4 localized thickenings. 2 are lens palcodes and other 2 are the nasal palcodes. These nasal palcodes develop into the nasal pits. See the curved structure in the second diagram. They are known as the nasal pits. The nasal pits are partially formed by the medial and the lateral nasal processes. See the differentiation in the diagram. These processes gives rise to the future nose. They originate from the frontonasal process. Okay. Then we are seeing the important process involved in the face formation. Now we are going to see the development of individual organs. First, the development of lips. See the diagram. When the mandibular process on the lateral side of the stomatodeum grows towards each other and fuses, it forms the lower lip and lower jaw. Likewise, when the maxillary process grows towards the midline and fuses with lateral nasal process and then with medial nasal process to form the upper lip, and medial and lateral nasal process are also fuses with each other. This is how the upper lips form. So the lower lip is formed from the mandibular process and upper lip is formed from the maxillary process. Except the philtrum of upper lip, it is formed by the frontonasal process. Okay. Then the development of nose. Okay. First, remember the previous diagram. During the formation of lips, the medial and lateral nasal process are fuses with each other. During the fusion, the nasal pits are cut off. See the previous diagram. The nasal pits are opened with the stomatodeum. During the formation of lips, the nasal pits are cut off and forms the external nares. External nares are nothing but the nasal openings. See, the nasal openings are apart from each other. When the frontonasal process, see the diagram, the greenish area, when the frontonasal process progressively constricts, it brought the external nares towards each other. Okay, then the mesoderm becomes heaped up in the median plane to form the prominence of the nose. Then the external nares comes to open downwards. Okay, first they are apart from each other due to the constriction of the frontonasal process and the mesoderm development. It forms the nose. Okay, next, development of cheeks. This is very simple. After the formation of upper lips and lower lips, the maxillary and mandibular process undergoes progressive fusion to form the cheeks. So the cheeks are formed by maxillary and the mandibular processes. Next, the development of palate. This is very important. It consists of primary palate and secondary palate. Primary palate is also known as the premaxilla. During the fusion of two medial nasal processes, it forms a wedge-shaped nose. Okay, this is known as the premaxilla. Then, from each maxillary process, a shelf-like processes start to grow vertically towards the tongue. They are known as the palatal shelves. At beginning, they grow downwards, that is towards the tongue. After the development of tongue and the lower arch, it pushes the palatal shelves. Then it starts to grow medially and fuses with each other. The fusion of the palatal process begins from the premaxilla. First, they fuses with the premaxilla, then it proceeds posteriorly. Okay. Then finally, it fuses with the nasal lower edge of the nasal septum. Okay. Any failure in this fusion process leads to the cleft lip and cleft palate. Okay. At a later stage, the mesoderm in a palate undergoes ossification to form the hard palate. Then the ossification does not extend into the posterior part. That part is known as the soft palate. Okay. Next, then the development of tongue. The development of tongue occurs in accordance with the pharyngeal arches. See the diagram. The first pharyngeal arches shows two localized thickenings. These localized thickenings are called the lingual swellings. In between the lingual swellings, that's the tuberculum impart. These processes forms the anterior two-thirds of the tongue. Then the hypobranchial eminence in the third arch, which forms the posterior one-third of the tongue. During this process, the secondary arch mesoderm gets buried below the surface. Okay. Then the posterior most part of the tongue is formed from the fourth arch. Okay. These processes fuses with each other to form the tongue. The anterior two-thirds is formed from the first arch and the posterior one-third is formed from the third arch and posterior most part is formed from the fourth arch. The anterior and posterior parts are indicated by a V-shaped sulcus terminalis. After the formation of the tongue, the taste bud starts to develop. Okay. Then finally, the development of tooth. Okay, development of tooth starts from the alveolar process. Alveolar process forms in between the labio and the linguogingival sulcus. Sulcus is nothing but a depression. In between the two depression, there will be a raised area. That area is known as the alveolar process, which is U shape. That is our arch. Okay. When the mesotome over the alveolar process become thickened, it is known as the dental lamina. After the formation of dental lamina, the dental lamina shows a series of local thickenings. They are known as the enamel organs. Okay. Um, there are 20 enamel organs. Okay. As the primary dentition have the 20 teeth. Okay. 10 in the maxilla and 10 in the mandible. Okay. See the diagram. The formation of enamel organ. This stage is known as the bud stage. Okay. Then after the bud stage, the enamel organs proliferates and project downwards. Okay. Below that, there will be a mass of mesenchymal cells formation. They are known as dental papilla. The enamel organ and the dental papilla together forms all of the tooth structures. Okay, the C shape, the C diagram is known as the cap shape, cap stage. Okay, then the mesenchymal cells differentiate into the ameloblastus. Then some of the mesenchymal cells differentiate into the odontoblastus, and remaining cells forms the cells of pulp. See the diagram. It looks like a bell. This is known as the bell stage of the tooth development. There are 3 stages in the tooth development: bud stage, cap stage, and the bell stage. Okay. Okay. The differentiation of mesenchymal cells into the ameloblastus forms the enamel. Enamel is the outermost covering of the tooth. Then the odontoblastus form the dentin. It is the second layer of the tooth. Then in the root portion, these mesenchymal cells differentiate into a cementoblastus. That cementoblastus produces the cementum along the root surface. Okay. Then some of the mesenchymal cells transforms into a periodontal ligament. It occupies the space between the root and the bone. Okay. This finally forms the tooth structure. Okay. This is how the tooth forms: enamel, dentin, pulp, periodontal ligament, and cementum are the important parts of the tooth. Okay. This is the end of our class. In case you have any doubts or any feedbacks, please type it in the comment section. Thank you. Thank you for watching.